Welcome back. Well, as I mentioned, we have Dr. Damon Anderson here, who's going to tell us all about his dentistry facility. Well, Dr. Anderson, welcome. How are you?
Thank you, Lisa. I'm great.
Good. It's nice to meet you and have you here. And so, before we get into all of the services that you provide, would you please tell me a little bit about yourself?
Well, I am from Riverside County originally, and I grew up there. I attended UC Riverside and then Loma Linda University.
Oh, okay.
Out in the Redlands area.
Okay. And is that where you got your dental degree?
It is.
Oh, okay, great. How long have you been practicing?
23 years.
A long time.
Yes.
A long time. Well, you know what? It's great. And, you know, you have a very unique situation, and it's something that I think needs to be addressed by probably all dentists, is that there's a lot of, anxiety that goes on. But I'll just show the real quick thing there. It's 3 out of 5 people have anxiety when it comes to going to the dentist.
Well, you're in a vulnerable position. You're laying back, and somebody's standing over you, and they got shiny things in their hands. Yeah, it's nerve-wracking.
Yeah, and then I know that's not the only thing that you cover. Tell me about the facility as a whole, all the different things that you do.
Well, I'm on the second floor of a medical building, not far from here. It's about from the Laguna Woods Village area. It's a 5 to 15-minute drive, getting off on a green field. And there's plenty of parking. There are doctors across the hall, down the hall, so it's outfitted for medical. Great elevator, lots of access, and it's easy to get in and out.
Okay.
Easy to find.
Excellent, excellent. And then some of the things that I know people were concerned about is, if you do need to be sedated, what are some of the things that you provide, and why did you focus on sedation in the name of your company?
I noticed when I was working that when I had my patients on the laughing gas, the nitrous oxide, suddenly they were more numb than they were before. Patients who had trouble getting numb, and it was their adrenaline.
Oh.
And you couldn't see it.
Okay.
You couldn't see it. Now I ask every time on a scale from 1 to 10, how anxious are you? And you can't tell by looking at somebody. They have to tell you, I'm a 10. Okay. So once I would put them on the gas, suddenly they were numb.
Okay.
And I could do the work. I'm like, you know what? I've got to have this for everybody.
Huh.
So that was the beginning. And then I added to that. I got my certificate, my licensing in moderate sedation, which is using syrups and pills, and also running the IV line.
Wow.
Yeah.
Wow. I wonder why people get so anxious with a dentist, but do they get the same anxiety with a doctor and just going to the doctor?
No. Dentistry, how do I put it? Dentistry's improved a lot.
Yeah.
Dentistry's improved a lot. But there are people who have had rough experiences.
Okay.
And they remember it.
Okay.
One of the things about sedation dentistry is you're not going to remember the appointment. You remember entering the office, and you remember getting back in the car.
Oh, but you don't
remember
any
the
of
appointment.
Oh my gosh. Maybe I should always elect to do it, because I don't think I've ever had it unless you have to pull a tooth or something.
Well, when we do the gas, it's free.
Oh, that's good.
Yeah, there's no charge for that.
Well, that sounds like a good thing. I mean, especially if you're doing a filling, and there, it's loud, and you can have earplugs in, but you still hear stuff.
We have TVs on the ceilings.
Yeah.
We have headphones, noise-canceling headphones.
Right.
It's great.
I think when somebody has to have some of those things, they're just kind of like don't want to deal with it. So
Right.
I don't blame you for having all those services for everyone, which is an awesome selection. So let's talk about patient safety. A lot of people ask about COVID-19 and how prepared each facility is, and I know we're sort of moved beyond that, but there's still a level of concern. What would you say to those folks?
Well, we're still in that format. We're still having people call from their car and come in with your mask and take your temperature and asking the questions. Have you been around anybody who's been sick or this, that,
Right.
And it's going smooth.
Okay.
It's going smooth.
Okay.
We've had no problems.
And then I know that you need to have certain types of certificates for different types of things that you use in your office. So I'm assuming that you have the latest and greatest equipment?
Yes, we do. Absolutely. We've invested heavily to be cutting edge and up to date, and I use the best products, no shortcuts.
Well, good. Give me an example of some of the things that are some of the latest technology.
I would say one of the things I'm most proud of is something called a cone beam scanner. It's a CT scanner that I use when I do implants and root canals. It's a 3D X-ray, basically. I could see everything in 3 dimensions. I could track everything. I could measure everything before I even start. And that's an $80,000 investment right there. And it's brand new.
It's brand new.
I mean, I've used older versions of this same machine, but I have the most updated version that they sell.
So is it quicker than something you would use before, or is it giving you more detail?
I would say more detail. And I don't charge for that either, because anything that will help somebody make a decision to move forward, I just do it. If it's an exam, X-rays, 3D, nitrous gas, there are certain kind of gateways, things that somebody cannot move forward in their decision making unless I can explain to them the next step, and that's one of the tools I use.
Well, I know that there's also intraoral cameras that are now available to use.
Every day.
You have that too, right?
We
Every
do.
day.
For anybody who has a hygiene, who comes in for their teeth cleaning, and I go in to do a routine exam, we get out the intraoral camera and we'll just do a little tour.
I know, and it's amazing what it does, because now many times you don't need to do any impressions anymore, right?
We have that also, the digital scanner.
Oh, okay,
for
so
impressions.
that's what that's for. That's great. So now we don't have to have that goo anymore.
I still use the goo sometimes.
Do you really?
We still have some goo.
Oh, man.
It's hard to get away from the goo.
I know it is. Now, you also said you do teeth whitening. What kind of teeth whitening do you do?
Glow whitening
What's
in
that?
office. So we put you in the chair, put the headphones on, we dress you up, expose just your teeth, we paint the gel on, you're there with us for an hour, and we wash the gel off, and your teeth are bright, maybe 2 shades brighter.
Wow.
And then you go home with also the trays, so you can do your own touch-ups at home.
Oh, okay. So how does that differ from what I think what used to be called Zoom? Is that kind of the same thing?
It is. Zoom is great. One thing I don't like about Zoom is it kind of dries your teeth out while you're in the office because of that bright light.
Okay.
And then you're really bright, but only for about a day. And then once your teeth become hydrated again, it goes down a shade.
Oh.
So it gives you kind of a false impression. It takes you like way beyond, then you end up down here.
Okay.
Whereas when you leave my office without the light and without the dryness, when you leave, you keep that.
Okay.
It's not kind of like a false.
Okay.
Yeah.
What about sensitivity when you do those kinds of things? Like gum sensitivity.
Right. People seem to know.
Okay.
They know if they're going to be sensitive or not. But I also have sensitivity gels that we could put on right after.
Oh, nice. Okay. Well, that's awesome.
Yes.
Is there anything that I've missed regarding your facility? I mean, tell me more.
Well, we have a wonderful staff, have a great team. We're all in sync, and we're on the same page. Those are my lovely people, Shar, Gina, Robin, and Elena. And
Now, are all of the people in this picture, are they all dental hygienists?
the 2 on the left are, Shar and Gina are, and then I have office people and have my surgical assistant on the far right.
Oh, okay. Now, surgical assistant would be for what types of things?
Implants,
Gotcha.
extractions. Sometimes I have to remove teeth, and I do bone grafting.
Oh, you do?
I
Wow.
do, yeah.
Oh, you know what else I saw on your website was TMJ. Are you you're certified in TMJ?
You know, we do lots of night guards, clear guards. I mean, you can get these at Walgreens or CVS, and they're fine. They're a little bulky, though, when you buy them right off the shelf.
Yeah.
We do custom that are trimmed so that when you sleep and you lay over, it's not pinching your lip.
Okay.
And the most important thing about a night guard that helps the TMJ fix itself is the ability for the lower teeth to scoot past the upper. So we have a hard night guard. It's soft on the inside where the teeth are, but it's hard where the opposing teeth hit. And when the lower jaw has the ability to scoot, it just relaxes itself. And those clicking and popping, for the most part, goes away.
I didn't realize that.
Yeah,
That is something.
yeah.
Is that something fairly new, or has that been around for a while?
No, it's been around for a while. We get our night guards from Glidewell Lab in Irvine.
Okay.
So sometimes I actually drop the cases off myself. They have like a drop box, and
Okay.
yeah, so they turn out great. I've been using them for 15 years.
Oh, wow. Well,
And
that's-
even when I was on the East Coast, I
you
would send
still
all my
use
things
them?
back to Glidewell.
Well, they obviously have a great product.
They
Who
do.
wouldn't use it? That's awesome. Well, I appreciate all of this information. So how would someone get in touch with you? I know you have a website.
Yes, the website is Laguna Niguel, sedationdentist.com. When you click on the website, on the lower right, you can schedule yourself, or you could touch a button and it'll put you through on a video call with me. So that's one way to do it. Or you can call the phone number, 949-643-3129.
Okay.
I'm available.
Good.
I am very available. I make myself available for
Good.
emergencies.
Excellent.
And any questions or conversations. We don't charge for any of this. If somebody wants to do a video call with me,
Oh, good.
yeah.
Excellent. Well, it sounds wonderful. Thank you so much for the information.
You're welcome.
All right. And remember, if you want more information about what we've just discussed, you can call 643-3129. We'll be right back.